Well, today officially marks the end of the COVID federal public health emergency. That means some COVID-related programs will be ending. Let's bring in Yahoo Finance's Anjalee Khemlani. Anjalee, there's a number of things over the last few years we've gotten used to, whether that's food assistance, free vaccines, but also telehealth and for some potential changes.
That's right, Akiko. So telehealth first, let's address that because we're actually getting an extension of the use of that, especially for Medicare members. The U.S. government has decided that because of the boost that it provided in terms of access to patients, including through audio only, that's going to extend through 2024. And then we also have separately prescription for controlled substances, think for maybe mental health visits and the like. That's going to extend for another 6 months until November 11th. And then any new relationships that have been cemented by then will get another year's grace period to get access to those prescriptions. And that comes after the DEA got a number of comments from the public asking for that to continue. Clearly some benefit there. As we all know, the telehealth industry really got a boost during the pandemic, lots of use. It has reduced in more of the general use area, but mental health has been one area that it seems to really be sticking. It's supposed to be a $50 billion industry by 2030. So no surprises there that there's some effort to keep it alive. Meanwhile, we knew, of course, like you mentioned, free vaccines, free tests, all going away. Those are still in play just a little bit because the government has a stockpile of those items. So until that stockpile depletes, we will see that. After that, it will be up to commercial insurers and the like to see whether or not that will be available and covered. And one other change is that there was an expansion of those who could sign up for Medicaid, and those will now be moved since that ends today. Those individuals who were able to access Medicaid because of the extension will now be moved to the Affordable Care Act market. So all of that to say, lots of changes. And of course, we know the virus has not disappeared. We're still seeing tens of thousands of cases daily, as well as thousands of cases, hospitalizations and the like weekly. So definitely something to still keep an eye on, but lots of changes all in one day.
Yeah, important to note that you're right. It has not gone away, but a lot of changes in store there. Anjalee Khemlani, thanks so much for that.